I started with a tennis elbow issue from my work as a beautician. So I go along to my GP. It was just a bit of a niggle, uncomfortable. And he gave me a couple of cortisone injections and unfortunately it didn't work. So I go back to the GP who recommends that I go and see Mr Shah. And if I go privately, I get it done very quickly and get back to work very, very quickly. And that's what I did. When I woke up from surgery, I knew immediately that there was something wrong. I just knew there was something wrong. The pain was horrific because I'd bled excessively, which again didn't make much sense if I was having a tennis elbow release. No one had mentioned excessive bleed or the possibility of excessive bleeds. And I'd got no movement at all. It was just like a dead arm. I couldn't move anything. It was just limp. It was quite dismissive. It was very much a case of, oh, everything's fine, I don't know what you're worrying for, you know, I'm 90% sure everything's all right, nothing to worry about, take the paracetamol, change the dressing, get on with it. That was his complete attitude. He was not interested at all, even though by this time I was quite hysterical that I could not move my right arm. Shortly after my second appointment with Mr Shah, I got a telephone call from my GP. He was quite concerned. He was asking how I was feeling. He'd actually had a letter from Mr Shah stating that whilst under anaesthetic, I'd had a stroke, and that's why I'd got the paralysis of my right arm. I'm not medically trained or qualified in any way whatsoever, but straight away I knew that wasn't right. Nothing else was affected on my body. Just the right arm that Mr Shah had operated on. Not my speech, not my face, not my legs, nothing else. Just my right arm that I'd had the surgery on. The nerve is severed. There's absolutely no signal whatsoever. I don't remember much else apart from getting in the car with my friend. And my friend saying, look, this is huge, you need to take time for it to sink in. You know, I'd gone in for a 10-minute surgery of a tennis elbow release, and here I was with a useless right arm, and I felt pretty bad at this point. Post-corrective surgery has been a challenge. From getting dressed, I have to decide what I wear now. Tights are impossible. Underwear was difficult at the time. My hair, makeup, brushing my teeth, everything was done left-handed. We're talking years of trying to learn to use my right arm again, including writing. I haven't been able to return to work. I'm no longer able to be a beautician or work in an estate agent as I did. I wanted to stop him doing it to anyone else because my life had changed so radically. Well, everyone's around me had changed so radically. And our friends had suggested that we contact shoesmiths in Birmingham and just have a chat with someone.
Jo came to see us and to get advice about what had happened to her. And at that stage, we were relying on information given by the hand surgeon as to what had actually happened to her because of the lack of information from Mr Shah about what he'd actually done in the operation. He'd rung her GP and said she'd had a stroke, which was patently not the case. She had to glean that information from what she'd been told by the surgeon who did the repair. It was an important task in Jo's case to assemble the expert medical evidence from various subspecialisms, from an orthopaedic surgeon, a pain management expert, and a psychologist, and then also from a care expert. It took time to investigate this because Jo was learning about how her injury was affecting her in everyday life. That includes in her job. One important aspect of that was that she was having to take a lot of heavy-duty pain-killing medication, and that was really affecting her concentration. And so it took us a long time to investigate those aspects, but it was important to do that because this was an injury which was going to affect her for the remainder of her life, and we had to be sure that that was adequately investigated. We assisted Jo in making a complaint to the GMC, a reference to their fitness to practice unit, because Jo was very keen to try and ensure that this couldn't happen to any other patients.